Krishnamurthy for remembering the great ideologies and some of his experiences with his teacher, beloved teacher, who was also here when he has become an assistant professor here. Sir was professor at HOD and superintendent of this hospital. And he was so honest because he has learned honesty from him. So he never leave the hospital in the timings.
Actually,
and he never did the private practice also.
Actually, Ramana, when I was in third year at that time, as soon as he came, he shifted me. Come on, you come to first year, next year. First year.
So he was such a loyal postgraduate, and now he has become a loyal assistant professor subsequently in this hospital. And so that was the greatness of and honesty of Krishnamurthy also, because that was the legacy he has got it from his teacher, beloved teacher, Dr. G.VENKATRAMAIAH. So actually I just wanted to speak about the closure manipulation reduction techniques. He was the expert in those days, because they used to develop third eye. There is no CM, only X-rays. We used to suppose in supracanal fracture of humerus. He rightly remembered. So this was his actually very good topic for him. So any type 3 also he used to manipulate just
even
by,
if he is going to Bangala also,
yeah,
he used to bring it.
Yeah, even if there is a problem also, because that was their clinical acumen. So they used to just take the X-ray and look at the X-ray. They used to manipulate, and we used to put the posterior slab and bandage in whatever required flexion, and then when we sent them for the cheek X-ray, it used to be very much in the place, as if you have seen or you have done it looking through the CM. That was their clinical acumen. That you should develop. So every time you go on shouting shoot, you will be totally burnt. So you always develop a third eye, especially when you reduce, maybe in the theatre and the CM also. You should always be wait for some time. Devote some time, thereby you will get the reduction in a nice way. If you go on looking in the CM, your brain will never function, you will never develop the third eye. That was their clinical acumen. He was expert in doing this, and he was expert in manipulating and putting a cast to the CTV. When there were no Pirani scores, when there were no such studies also, they used to treat. And also he was expert in post-medial soft tissue release and Darkos procedure in those days. Very excellent dissection techniques. Thereby he will correct the CTV within no time. By the time the baby attains the walking age, he used to have the very good plantigrade foot, and they used to walk with an optimal plantigrade feet. That was his clinical acumen and surgical expertise.
Never opened tibia.
Yeah. So see, as per Parsons Jones also, never make the closed tibia into open. Maybe you are doing it in theatre, you are making it open. I request all of you not to open the tibia unless it is warranted. So Venkatramaiah was so expert in that. So he used to put the above knee cast with a little flexion in the knee joint. Why you should keep the flexion at the knee joint? He used to tell us in so many ways.
But custom
So we used to hold it. So above knee cast, once the anti-edema measures she used to take, and above knee cast. So such was their clinical acumen and closed techniques. That's what I am trying to tell you. Closed techniques. Hanging cast in the humerus. Now we are talking about a lot about the humerus and open reduction, or internal open reduction, internal fixation with the plate, or closed reduction and internal fixation with intramedullary interlock nail. But in those days, what we used to do is the hanging cast, and we used to get very good results. But it used to take longer time, maybe 3 months, 4 months. But it used to he is also very expert in it. It used to give very good results. So that is the humerus closed technique.
When he was in Dept, he used to tell actually, high riding scapula, ఇక్కడ ఉంది అమ్మాయి ఉందా హై రైడింగ్ స్కాపులా చేసి అమ్మాయి పెళ్లి కాకపోతే పెళ్ళైంది.
Sure. See, this Pranjal showed high riding scapula also used to. So he was such a heroic surgeon. In those days, he used to, especially the soft tissue procedures, they were poliomyelitis surgeries, cerebral palsy surgeries. Likewise, he was expert. Actually, I assisted for him while he was operating for fracture femur. He used to open the fracture femur, retrograde. We used to have only the canines. So the clover leaf K nail, we used to retrogradely push it upwards through the pyriform fossa and we push it downwards while holding it openly. So he was very much expert in that. And once I heard his voice, so this way. So Ramana, if I don't operate a femur nail, I will retire on that particular day. This is that was his statement when I was assisting him. What in Telugu what he meant was, ఈ ఫీమర్ నెయిల్ కే నెయిల్ ఎప్పుడైతే నేను చేయలేకపోతానో ఆ రోజు నేను రిటైర్ అవుతాను అంటే హీ వాస్ సో రొబస్ట్. He's very, I think he's 6-footed and he's so robust and muscular person. 6-foot surgeon. He was very powerful and muscular person. So he used to make it openly reduce and he used to drive it down. So that was his statement while he was operating on a femur fracture while putting a canine by open veins. This was. And another important thing what I learned from him was he used to sit. He never goes away in the timings, never ever. And he used to sit like this in his chair, like a lion. We never used to cross that. He will be watching. We never cross that line. Lion and lion will be there. We never cross it. Like if he goes away only, we used to follow. Once he goes away, we will just see that he disappeared from our vision, and we used to follow him. That was his stature of.
వాడు ఫుల్గా ఉన్నప్పుడు ఆయన వచ్చేసి వెళ్ళబోయే ముందు వాడు గేట్ దగ్గర ఉంటుంది. అన్ని కేసులు ఒకసారి చూశాడు. దానికి టెస్ట్లు అయినాయమ్మా, దానికి చేశారా అని పొద్దున్న ఇచ్చిన ఇన్స్ట్రక్షన్స్ ఎంతవరకు అయినా ఇంపార్టెంట్ కేసుకి చెప్పాడు. 2 వారాలు ఇలా చూసుకుని అలా వెళ్ళాడు. ఇంకోటి ఆయన రాగానే ఒక క్వశ్చన్ ఇస్తాడు, వాడు ఎలా ఉన్నాడు అని. నేను సాయికృష్ణ ఉండేవాడు. వాడు ఎలా ఉన్నాడు ఫస్ట్ ఎవరు సార్ ఉన్నాడు, నేను కొట్టేసి వెళ్ళిపోయి కేసు చూసుకుని వాడు ఆయన ఉద్దేశం నిన్న మనం ఆలోచించిన కేసు, నిన్న మనం సీరియస్గా దేని గురించి ఆలోచించాం, నిన్న ప్రాబ్లం వచ్చిన కేసు అని. ఇంకేమన్నాడు వాడు ఎలా ఉన్నాడు అన్నాడు. సార్ బాగానే ఉంది సార్, బ్లీడింగ్ ఏం లేదు. వాడు ఈరోజు మేమందరూ సాయంత్రం కూర్చొని రేపు వాడెవరు అని అనుకున్నాను. రేపు వాడెవరు అనుకున్నాను. ఇది రేపు వాడు అనుకున్నాను. వాడు ఎట్లా ఉన్నాడు ఫస్ట్ రాగానే సంతకం పెట్టి రాగానే వాడు ఎట్లా ఉన్నాడు అని ఎవరన్నా ఎక్కడ కలపడినట్టు వాడు ఎవరు అన్నాడంటే జూనియర్ వదిలేస్తారు.
సో ఎందుకు చెప్తామంటే ఇది ఈజ్ టైమ్ సెన్స్. He used to stick to the timings, and also he used to take the curd rice in the morning. సద్దెన్నం తిని వస్తాను నేను. మేము ఎవరైనా ఆకలేసి అది టిఫిన్ చేస్తారో భయం వేస్తాడు, బయట అంటే కుదరదు. So he used to take the very good curd rice in the morning. He used to come, and up to 2:30, whatever the time, maybe OP, whatever time, we don't bother. He is such a very good personality. He is stable, very stable personality, and he used to teach us. His teaching skills are also very good, especially the long cases. He used to call all the postgraduates and teachers, especially the long cases which are going to put in the exam.
Tumors is excellent.
Tumors also, that was actually our legacy. Tumors, I am very fascinated about the tumors. So without knowing, without your knowledge also, you will try to imbibe your qualities of your teachers who taught to you. That is, without your knowledge, you just like your parents, you will follow your parents. Without your knowledge, whatever they do, their deeds only will be totally stuck in your brain. Likewise, your teachers' deeds also, and their mannerisms and their talking skills, all these will be totally imbibed by you without your knowledge. That is the legacy he has given to us. We really remember our beloved teacher. So many students used to be very good disciples for him. In those days, sir, I just try to put all these professors also. In those days, we used to have Professor Hanumantarao. Mr. Hanumantarao, who retired from Rangarao Medical College as superintendent also. He did his superintendent in GSL Medical College, Rajahmundry, and NRM Medical College also. He is the doyen of Hanumantarao, Professor Hanumantarao, doyen of CM is conducted throughout his career, maybe 20-21 career. CM is as long as he was a professor in the Rangarao Medical College, and also in these colleges also, wherever he went there. So he is residing now in Vijayawada. So he used to be there as teacher for us. They were all very good teachers. Satyadev, Raman Rao, Pullarao Garu. In those days they were our teachers. And professors like Lakshmi Narayana, Professor Adams also was there once. Professor Venkatramayaah come here. So teach students like Dakshinamurthy Garu, Raghu Prasad Garu, Sai Krishna Garu, Sai Murali Krishna, or Anil, the 13th person Anil, Ramesh Katta Ramesh. So many students, and we can't name them, but whoever comes to our mind, as Shyam, who is Professor as well. So I think you did from here.
Shyam.
So these were the, I just wanted to recollect the teachers who were with him. Nageswara, Professor Nageswara was there, he retired from Ranganathan College. These are the students and we need to remember them also. So we today with very painful hearts and from bottom of our hearts we pay tributes to the great departed soul of divine soul of Professor G.VENKATRAMAIAH. We are praying by 2 minutes morning, this morning after knowing his sudden demise through his family members. I pray the God to give strength for the bereaved family members also. Thank you.